Hello everyone. Welcome to this webinar about the fundamentals of international advocacy for rare diseases. Welcome. I see people are joining the webinar. Hello everyone, my name is Marta. I'm the EURORDIS Open Academy e-learning coordinator, and I'll be today's host. This is a joint webinar with Rare Diseases International and the EURORDIS Open Academy. People are still joining in. We'll start in a minute. We're just waiting for everyone to join the webinar. In the meantime, please introduce yourself in the chat. Tell us your name, where you're joining from, and the name of the organization that you represent. Awesome. So some housekeeping before we get started, and we give a little bit extra time for more people to join the webinar. This webinar is being recorded. It will probably last around 1 hour. We may extend it a few minutes if we get a lot of questions at the end. And the recording will be available on the EURORDIS YouTube channel in a couple of days. You can type your questions in the Q&A box, and you can comment on those questions and also upvote those you want to see answered first. Go ahead and also open the chat panel to participate in the discussion. We'll be monitoring the chat and share some useful information there too. And there will be at the end a short feedback survey. We would really appreciate it if you could fill it out, as this helps us assess how we deliver our trainings. So yeah, our two speakers have introduced themselves in the chat. Let me tell you a little bit more about them. Today we have with us Shaulani Macabella, a strategic engagement manager at RDI, and also Dolores Shivitichanin, sorry if I mispronounce, public affairs managers at RDI. And they will talk about why is international policy a priority for people living with a rare disease? What are the most important institutions and initiatives for international advocacy? Which rare disease alliances you can work with to advocate for your rare disease at international level? And also, how can you and your patient organization get involved in international policy? At the end, there will be a dedicated time for Q&A. And before I hand over to Dolores, who will be the first speaker, I just want to briefly talk about an online course available on the Open Academy platform that has inspired this webinar. This is a very good resource that explains the why, how, and with who of international advocacy, and also describes in detail 3 successful international advocacy case studies. I encourage you to go to the Open Academy website and check it out. And I'll stop sharing now and hand over to Dolores when you're ready.
Thank you very much, Marta. Good morning, good afternoon, good evening, everyone, wherever you're joining us from. Indeed, the Open Academy webinar has very heavily inspired this webinar. And I would very much encourage you to take this e-course. I myself have taken it, and it is very informative, and it's a great introduction to international policymaking, international advocacy, international institutions, etc. So my presentation will actually follow the structure of this course so that you can kind of get a feel of the course and see what each chapter kind of talks about. And then you will be amazed by it. You will take the course itself. So I have some slides that I would like to share with you, and each heading is basically based off of the heading from the course itself. So I'm sure you're going to have comments and questions, and please note them down. We're going to have, as Marta said, a Q&A session at the end when Shaulani and I finish speaking, and we're very excited to hear what you have to say. So the first topic that I'd like to speak about is international policy as a priority for our community. That is persons living with a rare disease. And I'd like to also add their families and friends too, right? So here on the right side, you can see a picture from 2019. It's a picture of RDI volunteers and council members in New York at the United Nations General Assembly. And I thought it was a fitting photo for what we're speaking about, because indeed, rare diseases are a global policy priority. They have been a global policy priority at least since 2019, when they were specifically mentioned in the political declaration on universal health coverage. Now we have, of course, a UN resolution on addressing the challenges of persons living with a rare disease and their families, which I'm going to speak about a bit later. But it is yet another international policy document, which yet again confirms that rare diseases are a global policy priority. Addressing the challenges of PLWRD, or persons living with a rare disease, is a public health, sustainable development, and human rights priority. Collectively, rare diseases represent 6% of the population. And to just put this figure in context for you, that's more than the population of Indonesia, which is the fourth most populous country in the world. And so countries should most definitely give them the same attention they give to other priorities like infectious diseases, non-communicable diseases, or disability. Now, from our side, international advocacy is vital to putting rare diseases, again, at the top of the agenda of international policymakers, and that's what we're here to speak about. And again, to put something in context for you, what can patient alliances do in international advocacy? This is probably something you've been asking yourself. You're here probably because you're asking yourself this, and will continue. And I know that Shaulani will speak about this in more detail, but I very regularly refer to the example from Hepatitis C International. There are 2 WHO resolutions on hepatitis. And due to their international advocacy and also to these resolutions, they've actually collaborated with the World Health Organization for licensing of new drugs to low-cost manufacturers in low-income countries. So moving on, what are some of the institutions and platforms for international advocacy? I'm going to speak about the 2 usual suspects. Of course, there are more, but these are the 2 very big main ones that we really need to know very well. The first is the United Nations. What is the United Nations? The UN is an international governmental organization. What does that even mean? It means that the UN is not a non-governmental organization. It is an international organization made up of governments, of member states. And they focus on trying to maintain peace and security, keeping friendly relations, addressing economic, social, cultural, and humanitarian issues. And also it's very much a platform for member states to come together and discuss various issues and possible solutions. The kind of major organ that we've been concerned with, especially in the advocacy leading up to the UN resolution, is the United Nations General Assembly, which is really the primary deliberative policy-making and representative organ of the UN. And currently it assembles 193 countries. So think about that, 193 countries have actually signed the UN resolution and have committed themselves to ensuring that rare diseases are covered under universal health coverage. So again, more about this later, and actually the course does a very good job of diving a little bit deeper into how the UN General Assembly is organized. So again, if you want to learn more, I definitely encourage you to do the course. The other major institution that we are dealing with is, of course, the World Health Organization. So The World Health Organization is actually a specialized agency of the UN. Again, what does this mean? I'm going to go to my next slide and then come back. So I know it's a little bit small on your screen, but I think you'll get the point. This is the entire UN system. And the principal organs, there are 6 in the Economic and Social Council. If we go all the way to the right, we have a list of all of these specialized agencies, and the WHO is just one of them. So to put it into context for you, that is where the WHO sits in the entire UN system as a specialized agency. And it has a mandate to further international cooperation for improved public health conditions. So this is its big general mandate, and of course that goes down to the nitty-gritty details. And within it, much as the United Nations has the UN General Assembly, the World Health Organization has the World Health Assembly, which is the decision-making body of the WHO. So this body is really focused on determining the policies of the WHO, appointing the Director General, and supervising financial policies, which is, of course, of major importance to us. Now, again, quite quickly, what are some alliances through which you as a patient organization or patient advocate can advocate for rare diseases at the international level? And of course, bear in mind, like I said, the course is actually going to go into more detail about how you can do this. These are just some high-level details. So the first is actually the NGO Committee for Rare Diseases. You might have heard about it, but it's quite specific, so I'm going to try and explain it to you a little bit more clearly. So the NGO Committee for Rare Diseases is actually a platform for multi-stakeholder collaboration. So that means that it can draw together individual experts, patient organizations, patient representatives, potentially doctors, geneticists, potentially representatives from industry. And it really is the main vehicle for action within the UN system when it comes to rare diseases. How come? So the NGO Committee for Rare Diseases is what is called a substantive committee, which has been established under the umbrella of the Conference of NGOs in Consultative Relationship with the United Nations, otherwise known as CONGO. So basically, this committee has undergone an administrative process to get it to a point where it, much as the other NGOs under CONGO, can enjoy certain privileges within the UN system and have access to certain platforms within the UN system. So again, because of this, it can act as a forum of interested parties, such as NGOs from the field of rare diseases and beyond, United Nations bodies and agencies, as well as individual experts, to come together within the UN and to hopefully further international policy. The other alliance is Rare Diseases International. You have our logo on every single slide in case you forget what it looks like. And we are the global alliance of persons living with a rare disease of all nationalities across all rare diseases. So we like to say that we are disease and nationality agnostic. And currently we have over 80 member organizations, like I said, globally. Whoops, that was too quick. So what do we actually aim to do? Well, here are 3, again, high-level objectives. The first is to advocate for rare diseases as an international policy priority. The second is to represent PLWRD and their families at international institutions and platforms. And the third is to support the empowerment of RDI members through knowledge exchange, networking, mutual support, and joint actions. And Shaulani, again, will speak about this in a little bit more detail. So, just to end off my presentation on a happy note, I would like to remind you that we, in fact, do have a UN resolution. that deals very holistically with rare diseases. It really tries to cover what a person living with a rare disease would experience in every facet of their life in society. And of course, since it is a UN General Assembly resolution, it actually represents the view of, again, 193 member states. It really reflects an extremely high degree of intergovernmental agreement and the evolution of political ideas in the state of global cooperation on rare diseases. Now, if you look at this image on the left side of this slide, you will see what have been grouped together as kind of the 5 major key asks of this resolution. So you can definitely find more information that goes much more in depth about these key asks, but generally speaking, they are human rights and inclusion, appropriate care, national action, which is basically where member organizations and national patient alliances come really into play. Extremely significant action is needed here on a national level by patient organizations. Inclusion in the UN system and a monitoring of progress. Please keep in mind that there is no report that member states or the UN must submit on progress in rare diseases within the UN system. However, as with any General Assembly resolution, it does have to be a topic that is addressed every 2 years at the General Assembly. So that is kind of what we mean by monitoring progress. And, oh, whoops, what did I do? Sorry. And before I end, I just want to be extremely clear. So the General Assembly resolution is not binding on specialized agencies, which we talked about, such as the WHO, but it influences them because they are de facto coordinators within the UN system. It is not binding on member states either. However, it really is considered an example of soft law. So again, this is what I was mentioning about national patient organizations, really taking this piece of international policymaking and kind of waving it in front of their governments and saying, you did sign this, which means that you really do believe that persons living with a rare disease and their families are entitled to certain rights and privileges. And very happily, it is actually binding on the Secretariat, on UN funds, and on UN programs. And this is a major area of work of Rare Diseases International, where we strive to really push these bodies to implement rare diseases into their work. So there you have it. I'd like to thank everyone for listening. And again, you can ask any question you want later. And I very much, again, encourage you to do the course. You will learn quite a bit. And I think I can give it over to my colleague, Shaolan. Thank you.
Hi, Dolores. Thank you. Marta, can I get started, or would you like to say something as well?
No, you can go ahead.
Okay, great. I'd like to just start by thanking everyone in the group. I was looking at the attendees in the group, and there's so many familiar faces and some unfamiliar faces, which is good. And just having patient advocates and civil society leaders from so many different countries. I think I saw Luxembourg, Lesotho, Italy, Argentina. So I think there's a really global audience for this, which is really important. It's really important to what RDI does, but it's also really important to anything we do with advocacy. For it to succeed, it needs to be powered and driven by a community, by a network. So I thought I would share a few stories with you just to make this more real. So as you know, the UN resolution was adopted in December, but an important part of the resolution's adoption was that there were patient organizations and individuals on the ground who already knew what the resolution was about and were there to really advocate for it at the national level. So, for example, very close to the resolution signing, the USA had come up and said, but what is this resolution? Isn't there already something for disability? Do we need this? And it was so important for us to have national patient groups on the ground able to explain to their national leaders and policymakers what this was about and why it was important to the US. I think the Kenyan group also came to me when we were advocating for the resolution, and they said, our government came to us because they noticed that this was happening at the United Nations, and they needed us to tell them about what is rare diseases to begin with, and why do we need this resolution. So I think what is most important is that you don't see RDI as this kind of ivory tower, because really its power comes from having different patient groups and different individuals really working together towards any policy or advocacy mission. I thought it may be interesting to describe what I mean by our members in our network, or what RDI means by this. So we have 85 members that are active in over 150 countries. In our membership is regional organizations like EURORDIS. I think a lot of you are connected to EURORDIS, have worked with EURORDIS in many forms, as well as organizations like APARDO for Asia Pacific and ELIBEAR for Latin America. We also have national alliances that are members of RDI. So these would be groups really all around the world, from larger groups like NORD in the US, or CORD in Canada, or CHART in China, to smaller groups, for example, Child and Youth Care in Zimbabwe, or a group that's developing in what's the latest group that we just had join us? I know that right now there's an application coming from Rwanda, which is a country where they're having their first national alliance developing, and they're asking to be members of RDI. So really the community is progressively growing and getting bigger. We also have international federations in RDI, and that really supports the mission. This is really important because international federations are disease-specific organizations that are working at the international level. They have a lot of knowledge advocating for a certain disease area and working with international organizations for that disease area. So they bring with them a lot of experience and a lot of clout from their previous advocacy work. We also work with multi-stakeholder platforms that can be a part of RDI. These would involve researchers and clinicians. And it's really important that when we are advocating for something, it is clear what its significance would be from the perspective of a patient group, from the perspective of health systems and clinicians, from the perspective of researchers, and even sometimes from the perspective of private companies. These are the 85 members are our official members, but we work with so many other national organizations that are not members of RDI, but are connected to other rare disease organizations as well. So just because you're thinking, oh, but maybe my group is not a member of RDI, or I am not a member of RDI or any of these other regional organizations, can I take part? The answer is actually yes, because we need those voices at different levels, and also outside of our membership. We also work with committees around advocacy. So for example, when we were developing the first draft of the UN resolution, it was really important for us to begin by working with a small committee that pulled together members from international federations, national groups, because they were also able to give different perspectives on what should be included in that draft document. We also have different working groups around access and diagnosis. So I do encourage you to maybe go on the RDI website and just try to take a look at the different areas of work, because you may find that you have a group that's doing a lot of work around access to therapies, and this is a policy area you want to become more involved in the international space, and I would advise you to reach out to RDI for that too. We also work with different expert panel groups. Please, if something comes to mind, feel free to put it in the chat or in the Q&A, and I'll discuss it later. One of the main tools that we work with is the idea of a toolkit. This idea of having instruments to really power and drive advocacy on the ground. When we develop a toolkit, it's really important that anyone can use those tools and really be a part of that advocacy mission in different ways. So we're not asking everyone to send a letter to a policymaker, which may not quite be for each advocate, but you may have a really strong social media platform and voices there, and you should be able to use the tools available to leverage that if you are wanting to support a certain advocacy mission. So for example, whenever you see a toolkit developed either by EURORDIS or RDI or any of the other member organizations, there tends to be what I call policymaker tools. So these are tools particularly designed for civil society groups, patient organizations, established patient advocates that are able to reach out to policymakers. They would include a template letter that you can modify in your language, or maybe modify for your particular environment. Different fact sheets that you can send to a policymaker just to help them understand what the mission is about. And maybe documents that can help you understand who the stakeholders are that you can reach out to and what the landscape is looking like. But then we also have what I call awareness raising tools that are really there for everyone. The idea is that you don't have to be a civil society organization or an established advocate to advocate. We all can. So the global tools tend to be things like social media kits with social media images and videos, and also requests and calls for action just to share your story. One of the most powerful things in rare disease advocacy, whether it's at the local or the international level, is the power of storytelling and making sure that policymakers are able to understand the individual stories behind their decisions and policy actions. We also find that because we are speaking about rare diseases, sometimes data and research can be limited, but stories really help to materialize that experience and make it more real for policymakers. So often you'll see, I'll speak a little bit about the toolkit for the first UN resolution. A big part of it was encouraging members of the public just to share their story to help policymakers and the public understand what it means to live with a rare disease and why we would need a UN resolution. The last kind of tools I think are equally as important as the first two, which are what we call the library or the resource tool bank. The library helps you if you want to understand a little bit more about that mission. So for example, when we were working towards the adoption of the UN resolution, it was good that there had been social media posts so that you could share your story, and that there were, template letters that you could send to a policymaker. But very often civil society groups said to us, we don't understand really what is a UN resolution? What is its impact? Why do we need this? What's the history of this document? So by providing some tools and resources just to help you understand the mission a little bit better and do some research, we found has been a really good way of supporting whatever advocacy is happening, and also for us to grow our own knowledge in the advocacy space. Great, so those are kind of the three main areas of the advocacy toolkits. I thought I would maybe tell you a little bit about some of the toolkits that we have produced in the past and are maybe planning to produce, well, not maybe, but will be producing in the future, and maybe how you could use them in your own advocacy or to support international advocacy as a whole. One of the first toolkits that we developed along with EURORDIS had been what we call the UHC for rare diseases toolkit, UHC for rare. You can find it on the RDI website. There's a link to it as well on the EURORDIS website. And this toolkit was really all about how universal health coverage can be used as a policy tool to address the needs of persons living with rare diseases. That, health coverage cannot be universal unless persons living with a rare disease are taken into account. When you looked at this toolkit, you will find, yes, social media images, kind of like the one in blue that I have right at the corner of the screen, but you'll also find a fact sheet that explains why rare diseases and universal health coverage should be linked together, which can help policymakers and understand this concept and also help patient advocates advocate for it. So that is one of the toolkits. A toolkit that we've since removed from the site, but that was really important, and I'll speak to you a little bit about it later, because I think it will really help you understand how we build advocacy at different levels, was the resolution for rare toolkit. The resolution for rare toolkit was really about calling for the adoption of the resolution. And ensuring that patient advocates not only knew that the rare disease community was calling for the UN to adopt a resolution, they all understood what the UN resolution was and different ways that they could reach out to their policymakers. So this resolution for rare toolkit, in the next 2 weeks, we're going to be relaunching it and calling it the Act for Rare toolkit. And why we are creating a new toolkit for the UN resolution called Act for Rare is that now that the UN resolution has been adopted, patient groups are often saying, okay, but how do we get our states to act on it? They have made all these promises at the General Assembly, they've signed this document. How do we make sure they know that they've signed it to begin with, that they know what's in it, and that they're ready to act on it? So I think my colleague Laura will be putting in the chat a little Zoom link to the launch of the Act for Rare toolkit, because the Act for Rare toolkit will be around providing template letters, resources, and social media all around how to encourage policymakers to act on the key asks of the resolution that Dolores had mentioned. Great. So I don't know, I'm a really visual person, so I thought it may be nice to show you some elements of previous advocacy tools that were used by the community. This was part of the resolution for RARE, so the first UN resolution toolkit. We tried to create social media elements in different languages, even though capacity did mean that we weren't always able to produce all the materials in all the languages, but essentially the basic advocacy tools, so the template letter and the logo of the mission was available in 5 different languages. You could also find videos that just explained, what the impact of this resolution would be. Everyone was able to take part just by telling their story. I will say that, yes, it was important that rare disease groups wrote to policymakers, that they had meetings with state officials. This was incredibly important. But perhaps one of the most important things was that ordinary people shared their story and just made this UN resolution, which can be something that sounds very institutional, become really, really human. So we had a family from Malaysia that became central to our campaign, just talking about living with 2 sons that had a rare disease and how having a UN resolution would change this. And this was an advocacy action that you could take whether you were a big group or you were just a member of the public that wanted to support rare diseases. Okay, great. So that's it for me. But I do encourage you to maybe join us in the next couple of weeks. I think it's on the 12th of October for the launch of the Act for Rare toolkit. And you'll see how it includes some of these parts. So tools for policymakers, tools for social media and the public, and also just more resources to understand this policy space and this advocacy space around the UN resolution. And I want to thank you all for giving me this time to speak to you. If there's any questions, please put them in the chat. I'd be happy to answer them.
Thank you, Shaulani. That was a great presentation. Before we kick off with the Q&A, I see that we already have 3 questions, so keep them coming. We have prepared a couple of polls, 2 questions, so I'm going to launch the first one. We invite you to vote, and then we all together comment on the results. Okay, let me launch the first poll. Do you see it? Yep, let me read it out loud. What tools do you find are more useful for advocacy? Social media posts and toolkit, template letter to send to a policymaker, fact sheets, stakeholder analysis, concept notes. Awesome, people are already voting. We are at 45% participation. Excellent. Oh, I think we'll reach the highest number of participation. We are at 75. Awesome. Okay, a few more seconds so we can get a few more answers. Perfect. Let me end the poll and see the results. Do you see the results? Yeah, I also think that they're all important, but I guess it was interesting to see what was the most useful tool. Would you like to comment on the results, Shaulani or Dolores?
Yeah, I'd like to comment. I'm not surprised that they said the social media. I was also really surprised at how many policymakers would come back to our director, Flaminia, and say, I had seen this thing on Instagram or like on LinkedIn. What is it about? Because you assume that social media is as a little bit more superficial, but a lot of them were just wanting to know because they had seen this going around Twitter. So it's good to hear.
Cool. Let's launch the second one then. Which UN body would you like to see the rare disease community engage with? UNICEF, United Nations Development Program, UN Women. People are answering. We are at almost 60%. Let's wait a few more seconds. Okay. And the most voted body is the United Nations Development Program. Would you like to comment?
Yeah, no. I think that makes perfect sense. The UNDP really covers a wide range of very pertinent issues to the rare disease community, so it fully makes sense. UNICEF also second in line, but it makes sense, right? 70% of rare diseases are genetic. So yeah, interesting stuff. Thank you.
Yep. Awesome. Stop sharing. We'll go to the Q&A box. If you still have questions, you can still type them in the Q&A box or share your thoughts on the chat as well. First question. I heard about the possibility of a WHO resolution to be adopted in a few years. What would be the objectives, the gains in comparison with the UN resolution? Who would like to take that one?
I think I'll jump on that one. Thank you,
Okay.
Marta. Thank you to the anonymous attendee who posed this question. Yes, indeed, a WHO resolution is most definitely a piece of international public policy that RDI would very much like to go for. So we are in the process of actually developing the major key asks of this resolution. So it's really kind of early days in the drafting of these key asks. And as we go along, we will most definitely be including the rare disease ecosystem at wide, and urging everyone to participate in the development of these key asks so that we can gain as many perspectives and expertise as possible in knowing what should be in a WHO resolution. The UN resolution, by its nature, actually necessarily is a very, like I mentioned in my presentation, it's a very holistic document. So what do I mean by that? It really covers not just the kind of challenges that a person living with a rare disease would encounter when going through the healthcare system of their country, but it's most definitely challenges that they would also encounter in society at wide. So when it comes to gaining employment or gaining psychosocial support, or at school, or potentially, I don't know, gender barriers, et cetera, et cetera. The WHO resolution, in contrast, is a much more technical document, which is focused really on healthcare provisions for persons living with a rare disease and their families. So the objectives and the gains would be much more focused on, for example, newborn screening, access to clinical trial drugs, et cetera, et cetera. So like I said, much more technical and oriented towards something that one could get from a healthcare system. So of course, we are absolutely going to keep everyone updated on this as we go forward. And like I said, it's really a document that we want to make sure that we draft with the community at wide. So yes, thank you again for the question.
No, thank you for responding in such detail. Second question, what would be your advice for a young rare disease organization to start advocating for people living with rare diseases, especially as we don't have many resources? I guess that we could link this question to the third one about how an individual can participate in international advocacy if they don't belong to an organization or their organization is very new or very small.
I can, maybe Dolores will extend the answer, but one of the things that I would say is that sometimes by calling it international advocacy, it can sound very far removed from what anyone can do. Like, oh, you have to have connections in the UN or at least be like a registered patient organization. And I really want to emphasize that that is not really the case. That often we have found champions being individuals, firstly, because sometimes individuals are able to share that story of living with a rare disease. Just to maybe go back to some of the history of the UN resolution, for us, a big turning point was developing a small little video that was about life with a rare disease. Because very often policymakers were talking about rare diseases, and they said rare diseases belong at the WHO. This is a health issue, not a UN issue. They did not want to hear about it. It was about medicine, science, not them. We had to show them that actually rare diseases are a social issue, that you live with a rare disease throughout your lifespan. And this came a lot with encouraging patients and patient organizations to share their story of what it actually means to have a rare disease, that it meant that it was more difficult for me to get my child into school because, for example, teachers did not understand their particular needs or thought that they had more needs than they had, or that if it was like a rare skin condition, other kids thought it was contagious when it wasn't, just because they didn't know that much about it. So because it was rare, there was certain social aspects to it that you can't really explain as in a disease. You really have to explain as an individual story. So I do encourage that you don't just share your story, but you try to link that story to other international movements going on. So for example, if it's not RDI and like a call for a UN resolution, maybe sharing that story with the Rare Disease Day campaign, and it just becomes a story about raising awareness. One of the biggest international advocacy actions you can take is raising awareness. Rare diseases are invisible. Nobody really sees it. When you don't see it, there's never going to be any kind of action on it. So essentially for me, I think visibility is one of our biggest challenges, and this needs to happen at different levels. It can, yes, happen at the institutional level, having, the EURORDIS, the nodes of the world, but it also needs to show that, yes, my mom lives with a rare disease, or, I have friends, that this is just a part of social life, and that happens at the individual level. I also want to maybe note that a lot of rare disease organizations started off as small parent groups. There's a lot of members of RDI that 3 years ago, they were just a WhatsApp group formed by moms that had kids with a rare disease. They started this group and it became slowly a relevant rare disease voice in that country. So I do think starting is really important, and also starting where you are, and understanding that, whatever that action is, even though it may not seem immediately to spark change, there's something really important about it, especially for movements that struggle to gain visibility like rare disease.
And Marta, would you mind if I just said a little thing?
Go ahead.
I think Shaulani hit the nail on the head saying that it's important to start where you are. International advocacy might sound, ooh, it's international, that's so amazing, but actually, really, in reality, so much national healthcare system change happens at the national level. So I would really encourage people to focus on developing that kind of ecosystem, I always say, in the national context. So that can mean, being aware of who we're even dealing with, who are the patients, who are the families. Somebody in the chat was saying that the effect on families is enormous, of course. Who are the caretakers? So being aware, educating yourself, and then coming into contact with them, starting to form alliances, starting to realize who are the policymakers, again, within your national context that you're dealing with. Would you be approaching the Ministry of Health? Do you think you should be approaching the Ministry of Education to address children in the education system who have rare diseases, who have very specific challenges in the education system? So being aware of stuff like that. And also, I mean, we're very, I hope at least that we're very approachable. You can, you know, we're going to put our emails in the chat, and you can always message us. And like Shaulani said, we're not limited to just our member organizations. You can come into contact with us. There's so much that we can learn from you, and how you can be involved in our work. Your expertise is very much needed. So
excellent. Thank you both for answering. We have another question from Kimberly. Sorry, Rebecca went first. Will the Act for Rare campaign be the topic for Rare Disease Day 2023?
Oh, that's really interesting. So I'm saying that's really interesting because this is what we're talking about right now with the Rare Disease Day campaign. So I don't want to maybe say too much yet.
Spoil
but really, yeah, but honestly, I mean, for me, I believe this is the community anyway. What we want to do is that make Rare Disease Day 2023 really around the question of visibility. So an Act for Rare is really about like making that mission visible. So maybe not directly, because we haven't discussed this as a team yet, but definitely from the RDI perspective, and we work really closely with the Rare Disease Day campaign, what we hope is to put the focus on being seen, and then making that being seen be a catalyst, create action. So at the national level, I'm also sometimes a bit hesitant about saying, oh, this is what Rare Disease Day is going to be about. Because what I noticed is that at national level, organizations take the international campaign and do really such incredible things on their own that are nationally relevant and still like speak to the international policies. So for example, last Rare Disease Day, I had the privilege of being in Dubai. And the national group there in Dubai had planned a Rare Disease Day event. They were using all the Rare Disease Day branding, but they made it so relevant to their national context. It looked like an event that was happening in that country. And they took, you know, the idea that the resolution had been adopted, but they took the parts of the resolution that were relevant to them in Dubai and made that day kind of focus on that. So I think what RDI and the Rare Disease Day campaign will do around action and visibility is really important. But and definitely like speak to me about like what you're doing in your country and how the international movement can speak to that. But I definitely think that the most exciting action really happens at the national level or at the disease specific level as well for Rare Disease Day.
Great. Kimberly is asking, is there a summary of the UN resolution and its implications?
yes, it's coming on the 12th of October, and you should sign up for the webinar that will introduce it. Basically what we've done as part of the toolkit is we've created an executive summary of the UN resolution itself. So we've kind of put in more layman language every single operative paragraph and what it's really asking for. So absolutely, yeah, that's one actually really big thing that we've heard from patient organizations, like, can you just quickly tell me what the UN resolution wants? So we decided to do it. So there you go, you'll have it.
Yeah, this webinar is going to be great. Sharon DV also asked in the chat, do you include sexual orientation and gender identity in your advocacy and research questions? Who wants to take that?
Is this in the chat? Or
she wrote it on the chat and then we copy pasted on the Q&A.
Because I want to reread it one more time. I'm sorry.
Do you include sexual? It's in the Q&A, but I'll read it out loud again if you want me.
Yeah, please.
Do you include sexual orientation and gender identity in your advocacy and research question?
Well, we actually do include gender identity. We have so far, and we're you know, obviously learning and open to seeing how we can improve going forward, but we definitely include gender identity. I would point the person who asked this question to our side event at the High Level Political Forum, which actually dealt with looking at SDG 3, which is gender equality. And you can see it actually, I think, on YouTube. It's a recorded session. And basically, we're not just looking at, how rare diseases affect women and girls, but absolutely looking at the LGBTQ2IA+ community and gender issues at wide. So we've tried to integrate it as much as possible. And again, if you look at the UN resolution, and you'll see this in the executive summary too, it's absolutely an extremely specific ask within the resolution.
And we have one final question from Magda Dacord. And she says, can the resolution for rare diseases be used along with existing policy calls for a common disease? And any comments how to use it to support our efforts? And I think she means supporting early FH cholesterol screening, if I understand correctly. I don't know, Magda, if you want to maybe give us a little bit more extra information on this question?
No, it took, yes, no, thank you. And Magda, please feel free to give more information if you will, but I would say, very simply, yes, I do think that it can absolutely be used with existing policies. It's really like I said, like the resolution is a piece of soft law, so it is not a national strategy that must be enforced within the national healthcare system. But again, it's something that states have committed to. So absolutely, it's kind of like working in the background of any law that's specific to a certain nation. I think definitely can only bolster any more specific laws and claims to improving a national healthcare system.
Yeah, I also think it's important to add that a lot of our members are disease-specific organizations. So they may have made some progress on a certain diagnosis issue or health issue related to that disease. And then they're able to use that international policy framework just to further support that. Just to say that, and yes, it is a rare disease and you've promised this. I think the more that you have to support the point, the better. And so I wouldn't closet your rare disease advocacy only looking at rare disease policies. In many ways, universal health coverage is a policy that covers all conditions, but we've also shown that actually it should also cover rare diseases and support that movement. So in as far as using frameworks, I definitely think use what's there that is relevant.
Excellent. We have 3 more questions. One from Sheila. Any projects related to job discrimination due to rare diseases?
Thank you so much, Sheila, for that question. Like I said, again, so it's mentioned in the UN resolution, and one of the reasons why I asked which UN organization would be most pertinent, in your opinion, for us to approach is because the UNDP actually, of course, does work with any barriers to employment. So amongst, of course, the many other things that it works with. So I thought it was interesting that everyone agreed that UNDP is the most relevant, and definitely we are approaching the UNDP and will be hoping to work on this issue and many other ones with them. The other organization that we actually also hope to approach eventually is the International Labour Organization. So of course they are extremely active when it comes to disability, and so we'd like to hopefully extend that towards rare diseases and see how we can improve access to the job market for persons living with a rare disease and their families.
Thank you.
Marta,
great.
can I make a last point? I saw somebody had mentioned whether everything was only available in English. That is something that we are working on, and there's still a lot of work to do. We are trying more and more to translate everything, especially in Spanish, because there is high demand, than in French and progressively more languages. we do need support in this area. So if you see something that you think would be a useful resource or something on the RDI page that isn't well translated or you think you can translate, please do feel free to reach out to us, because we do need support and maybe even volunteer support in the area of translation and accessibility.
Yeah, I think Sholani has put her email address in the chat. If not, she'll do it in a second, and you can reach out to her if you wish to collaborate with the translation. Rebecca has also asked another question in the Q&A box. When we talk about rare disease being more than the medical side, but also a need for a holistic approach to social care, employment, housing, and discrimination, do we not have much of this in common with the wider disability community? Interesting question.
Yes, a very, very, very common question. Thank you, Rebecca. So I don't know how familiar you are with the work of RDI in the last 6 months or so, but we actually had an intern, Leah Jabali, who was really researching this exact topic. What are the differences, the similarities, the crossovers, the shared common ground between the rare disease community and the disability community? And Leah did this in conjunction with her master's thesis, and she actually held an entire webinar based very much on this topic, which I think is also available online. So Leah will be coming back and she will be doing more work on this, because it is true that whilst we do have absolutely very many commonalities with the disability community, we actually also want to make it very clear that the population of people living with rare disease globally have very specific also needs and challenges that are, again, specific to living with a disease that is rare, that happens, 1 in 2,000 persons. So yes, so stay tuned. There is more to come on this.
Excellent. And we have one last question from Andrew. Hello, I'm a mother of a young man with CDG SSR4. I'm not sure where to turn to advocate for CDG.
I think I saw in the chat, there was somebody that offered
help.
Yeah, assistance as well. I mean, I would definitely be happy to look further into that with the EURORDIS team as well. Yeah.
Andrew, I used to be the Rare Connect manager in the past, so I know a few organizations for CDG, and then I'll put you in touch with Nisha. Sorry if I mispronounce your last name, Venugopal, and we can see what, yeah, Anna, excellent resource, World CDG is an excellent organization, and we'll see what we can do for you. Here's my email address. And please send me an email and we'll find you a few organizations you can contact. And then if there are no further questions, I have just a couple of things I would like to mention before I close this webinar. Let me share my screen. Yeah, amazing questions, very, very well thought. First of all, I just want to mention that we just launched the call for applications for the Open Academy schools for next year. Next year's schools will both take place in Barcelona during the same week. We are going back to face-to-face training and with a new format, which consists of 3 days of parallel sessions and 2 days of joint sessions. We are very, very excited to go back to face-to-face and to present this new program. The applications will close on October 24, and we encourage you to apply if you haven't attended any of these schools before, or share the call for applications with other members of your organization. And RDI also organizes a webinar with the WHO on the use of ICD-11 for rare diseases. The webinar aims to emphasize the use and the importance of ICD-11. And I'll share all the links in the chat if I haven't already. Yep. And that would be all from our side. It was a great webinar, lots of interesting questions, a lot of people from so many different parts of the world. And this will be recorded and will be uploaded to the EURORDIS YouTube channel soon, and you'll all get the link. Thank you, everyone. Don't forget to fill out the survey that will pop up once the webinar room closes. And we hope to see you again in another webinar pretty soon. Thank you.
Thank you, everyone. Have a great day.